We have a committee for code stroke, and what we've done is we've all sit down, come up with an action plan to improve times on how quick the patient is diagnosed with a stroke.
So we're charged with improving EKG, door to EKG times and door to troponin times.
We figured out how to respond quickly to get those results.
From a laboratory perspective, we were sort of an ancillary part of that. We're just one little portion of the code stroke or the code STEMI.
And then with the heart attacks, the same thing. The code STEMI is you're wanting to get the patient through the door. If necessary, you need to get them either on a helicopter or in that ambulance to get them to mission.
You look at their age and risk factors and how do they look, and luckily we have like awesome registration people and they recognize that somebody looks ill.
So we work with the ER and other departments to make sure we've got good workflows in place. We use timers in the lab from the time we receive the specimen.
The saying is with a stroke, time is brain. And same thing would be with the heart, with the code STEMI. I mean, you're looking at someone's heart and the condition it's going to be in afterwards.
Never want to miss anything, never.
That 60-minute turnaround is very lofty.
And that's the goal, is get them treated as soon as possible so they can, afterwards, that they're going to be able to function the way they want to function.
We have to work as a team, and I think that was the big thing that came out of our code stroke and code STEMI, was bringing all the departments together and working out designated workflows so we didn't get in each other's way.
We're just all in this together. Everybody has their strengths.
Never goes exactly the same every time. It's always a little different according to the patient. But we have seen patients that's come in and out the door very quickly because we have come up with this new process to get them through. We all work great together, and then with the nursing staff and the physicians, I think we all work really well.
For many years, I have always found my job interesting, but my job has become much more interesting since I learned about sepsis.
The sepsis team came to be because we realized as a hospital that there was a disturbing trend in terms of outcomes for patients when they came in critically ill from bacterial infections.
And sepsis is the major killer in the United States.
You can look at sepsis nationwide, and a lot of times it's missed until it's almost too late.
And even the average educated person doesn't realize this. I didn't realize it.
Sepsis can be really sneaky. You can be fine, and an hour later, you can be dying.
For example, if somebody has a leg infection and if it turns into sepsis, you don't just have an infection in your leg, you have an infection in your bloodstream. Your heart can be affected, your kidneys can be affected, your brain can be affected, your lungs can be affected very rapidly.
With early intervention, you can avoid all that.
If they come in and it's recognized and treated appropriately, in 3 days they can go home. If it's not, they might not go home.
We wanted to develop a system to recognize these patients early and have a standardized protocol for treatment so everybody's on the same page.
The importance of the sepsis protocol lets you screen for warning signs early. And if you can catch it before it gets that bad, their chances of survival go up greatly.
It's my passion now.
So with our team, we were able to develop the protocol. We used the international guidelines, and we tweaked those to meet our needs here.
I think that sepsis is a fascinating topic because it's something that is so often under-recognized.
It's been amazing. We have seen people who you thought were going to die in the next 5 or 10 minutes recover within a few hours.
I'm excited about it because we're actually seeing that by changing long-time practice patterns, we're getting better outcomes.
It's a multidisciplinary team. You know, it's nurses, physicians, respiratory therapists. The lab is very involved here.
It takes everyone working together to battle this disease, and it can be fought. What we want to do now is share it, share the information. Everybody knows what code blue means. Somebody's having a heart attack. We'd like to see code sepsis.
Sepsis, what excites me the most is saving lives.
This is a great service to our patients and our community, and the people I work with are very, very committed people.
They've been challenged as a group to do things that aren't in the normal day-to-day, the repairs and maintenance, the preventive maintenance things.
We take care of the facilities. We ensure the utilities, water, HVAC, all electrical phones.
You name it, anything in the hospital that breaks, we work on it.
Trying to make it as comfortable for the patients as we can.
To help facilitate all of the construction and the remodeling that's going on here.
And it's very fast-paced, it's dynamic, it changes day in, day out.
It can be very challenging in the sense that we got something that we need to do that takes 2 or 3 days to do it in, but yet we have to stop what we're doing to do things that are emergency related. Probably my favorite part about the job is the people that I work with and the people in the hospital.
The people that work here, you know, coming in each day and being able to spend time with those other employees within the hospital, there's a lot of great people here.
And I can go in and fix that problem quickly, efficiently, and get out. And they usually thank us, of course, when we leave and stuff, and you know, that's rewarding.
Well, we currently have several renovation projects within the hospital. We just finished the front lobby area and admin area. We're currently working in the cafeteria. There's a cafeteria addition that's being built onto the hospital, and remodel, renovating of the existing cafeteria space.
And really trying to impact the patient experience here at the hospital and make it great. And they've just really been instrumental in helping us manage that change.
Although it's very tiring sometimes and very stressful, it's part of those everyday challenges that makes every day different.
All the patients that are here are sick, and just trying to make it as comfortable for them as we can. That's our job.
They're very humble folks that really work hard to make a difference, and I think this is just the reward and recognition for all the hard work that they have put in, all the overtime, all the weekends.
I kind of look forward to it myself, you know, getting up and coming to work, and I can't say I've always done that.
You know, being from this community myself, it's an opportunity to serve back to the community.
You know, they're really guys that are deserving of that recognition, and again, unsung heroes that we really just are glad they're on our team here at McDowell Hospital.
It was a multidisciplinary team that was focused around case management and pulmonary rehabilitation primarily.
3 times a week for about three months, we get to really understand the patients and where they're coming from and build up really good relationships with them.
We're there to prod them, keep them on their pathway.
Part of it included pulmonary rehabilitation, case management at home, and also to help encourage standard of care for some of the medical offices that are supporting these patients.
Coaching is a big buzzword now in rehab, so doing more coaching techniques with the patients to help them make their lifestyle changes.
Watching their sodium, you know, or having so many vegetables and so many fruits a day, and you know, are they getting enough sleep?
We were able to utilize staff that assisted with case management at home, so the patients were instructed as to smoking cessation, appropriate exercise routines, and the provision for certain medications. The result is a patient who's able to help care for themselves.
It's huge to see, you know, each day they're maybe increasing their speed on their treadmill or time.
A lot of them do get to the point where, oh, I went shopping for the first time, or I could make it up to my mailbox, which I haven't done for a year.
They realize, hey, this is working, you know, this is increasing my strength, I am getting somewhere.
And the goal was to reduce emergency room visits as well as hospital days in this population of patients, and both those goals were achieved.
It's nice to know that you're helping people.
I especially remember one lady at the end, amazingly, had changed. You know, she came in, her face was, you know, you can just see it on her. She was very depressed, and then by the time she had graduated, such a different outlook on life.
From our general standpoint in the office, I think seeing patients with chronic illness and having the ability to intervene and help them in the long run is quite gratifying.
So our patients, although they may not hear about the SPD, it is out there and we do touch every patient.
Many times it's not clearly recognized what actually goes on in sterile processing, and that the amount of responsibility that the department has to manufacture, if you will, a sterile product.
The main purpose from value stream mapping is to identify how much opportunity for improvement you have in this process. So it came out to be significant, almost 90% across all through those units.
So the surgeon can do the surgery of a lifetime, best one they've ever done, but if SPD doesn't deliver a quality product, then the patient's still at risk.
To do no harm is the biggest component that we touched on for SPD.
So the cleanliness, the sterility of those instruments is big issue in other institutions. So we are providing better sterility and better equipment to be used on our patients.
And also have a separate part which is the preventative maintenance, and that counts the trays as they're being used and when they need to be sent out for maintenance.
We have action items related to standardization across 3 campuses. There is lack of standards between those 3. So standardizing the process for missing instruments, standardizing the process to deal with maintenance of those instruments.
So every week we do a minimum of about 180 different tests to assure that those things are working properly. That helps us assure that we have a sterile product, then that the patient will be safe.
I'm also a patient safety officer, so in addition to being on the SPD value stream mapping team and doing some of the work for that team, I also review all the event reports that come through surgical services. And one thing that I have seen is a significant decrease, if not the absence of reports of contaminated instruments.
We've been able to address over 90 different action items.
It was one of the greatest experiences in my career. Very enlightening to work as a team and to see how processes can be laid out, to follow the processes and then see how much we can do for improvement. Lots of opportunity.
I've been on several value stream mapping teams. This one stood out by far for me.
So for the staff to have the recognition and have the support across the institution, which has been fantastic, is huge.
The team was sought out to help with some of the issues related to some safety events that occurred, primarily with the devices that we had rolled out 4 years ago. So they're the dolphins and zebras. Everybody knows the dolphins and zebras.
So Dr. Maples asked us to form a team and really take a look at why those were occurring.
One error could cost a patient a life, and we just cannot do that. So it's really putting the emphasis and making everybody realize, yes, it may just be a specimen, but it's not just a specimen.
So what we started to do with our small team at that point in time was really go after those errors.
We put a lot of time and effort into making the printers work better and the dolphins to be more reliable.
I came from the IT side of things because I helped roll that out, like I was saying, 4 years ago. And more recently we started seeing some things with our wireless network that was causing some of these issues.
The project itself was escalated to a top 3 in the hospital, and with that we got more resources. We really got the attention and focus with IT. We got our team member Danny on time, almost full time on this. And then we also realized we needed to expand beyond the ED.
We have reduced the errors by 50%. Our goal is 0, but we're at the point of 50%, which is tremendous. We've done a lot of work with the areas that have had more, and that's the areas that do more collections, so you'd expect them to have more.
So to actually see the end result has been great.
It was peeling that onion layer by layer, really looking at our equipment, looking at our processes, doing re-education, and really trying to, again, really help our caregivers.
So now we don't have to go grab this dolphin, we don't have a separate login, there's not a different application, it all works in the same application.
Last month we had 10 errors per month versus, I think it was 43 last July. So we're still not at zero. That is our target, is 0 defects, 0 errors. So it's still a work in progress. But the team has done an immense job.
I'm very optimistic that we'll be able to continue to reduce. 0 is always the goal. We've had a 50% reduction really just with education, and it's been basic education of things that we assumed that people knew from the beginning.
I didn't realize all the people it took to make a team like this.
We could not have done this without everybody's attention and really taking it so seriously. The passion that everybody has shown by knowing the potential errors has just been incredible, and that is what's kept us focused.
So that fits in the bigger aim, really in that area of safety and quality and making sure we deliver a perfect outcome every time.